Good afternoon. Please tell us what your name is and where you're coming from and why you're here in Swiss Medica.
So my name is Chisom Okorie. I came to Swiss Medica to have stem cells for my child. And he's autistic. He was diagnosed just before he turned 2. But before then, we kind of didn't really notice any remarkable changes in his development, him being our first. So, but the nursery were the people who, started telling us that they think he's autistic. And then we didn't really notice anything. He was developing normal. The only thing I did notice, which the doctors didn't have any issues about, is that he took quite a while to walk. So he had his first steps when he was 15 months. But they weren't really that concerned or worried because they say some kids could walk at 18 or there. But he had eye contact, he smiled, he had social cues, but then he didn't say any word whatsoever. So up until now, he hasn't said mama, dada, no words at all. So from then on, we started going to the GPs because we live in the UK, going to the GPs to tell them about this, and his pediatric community pediatrist then did a referral to the neurodevelopmental team, and then he had his ESCP, which is like Education, Health and Care Plan. So he had that as well, and that would help him towards his schooling and all of that, getting a special needs placement and all of that. And then the referral to the neurodevelopmental team helped him to get his formal diagnosis. So, but before he turned 2, we already knew he was autistic, but they had a period of like 2 years to then issue him a formal ASD diagnosis.
So what kind of treatments were you offered to try with your kid?
So he was seen by the psychologist. We've done a lot. He was seen by the psychologist, speech therapist, occupational therapy, because they said his sensory needs were really high. So to enable him, give him some training towards managing his sensory needs and sensory overload. So we were seen by the occupational therapist, but they couldn't really do much for him because they said they didn't have funding to cover all of that. Then the psychologist just did a little pepper walk around, what could help him, in his emotions and his behaviors and all of that. And then we also had to do loads of audiology tests because he wasn't producing words. So each time we said he wasn't producing words, they'll be like, we'll book you for another appointment for audiology to make sure that he heard properly. But we didn't have any issues about his hearing because once you're hovering, he goes like that. So if you're blending, a motorbike zooms past, he goes like that. So we know he does hear, but he's not making any sounds. He's not making any speech. So these are the things really that they were. And then because typically children on the spectrum, the parents report that they have problems sleeping. They find that they don't sleep at night and all of that. But with him, he sleeps really well. So, because they were willing to offer us some sleeping pills if he needed it, but that wasn't the case. He didn't need any sleeping pills. He sleeps okay. He puts himself back to sleep. He's got sensory lights in his room. So even when we check him on camera and he's awake, he's just looking at the lights. He's enjoying it. He's giggling to himself. And then he puts himself back to sleep. It's not really long, maybe half an hour-ish. And then he puts himself back to sleep. So they really, that was the only medication, so to say, that they could have offered to sort of help him, if that was the case, but that's not the case. The really challenging bit that we really had is around his understanding. I mean, communication, they are intertwined. So if you're able to understand, you'll be able to communicate of some sort, maybe even doing gestures and all of that. So in his school, they tried with the speech therapy, speech and language SALT team, they tried using PECs, so it's pictures, so they draw some pictures, and you have 2 sides. So either ourselves, parents and him, or the teachers and himself, and then let him choose something he would like to do. But that is not really working. That hasn't worked at all because the most challenging part is the understanding. There's no understanding. So he's 6, but his understanding we would say it's that of a 1-year-old, 2-year-old at most. So his understanding is not quite there for a child his age. So it's been a struggle trying to look after him, or trying to, care for him. So these are the sort of treatments that you could call them treatment that they offer adults back in England. It's just this, and then they put him on a waiting list for speech and language therapy. We had to even go private. We had 2 to 3 sections private where we paid out of pocket, but it was no help because we just say he needs to understand to be able to follow what the therapist is doing. So if he's not understanding, it's difficult for him to follow with puzzles or, pegs and all of that. But we haven't tried ABA because we didn't, where we live in our city, we didn't have any opportunity to have the ABA treatment or even the Makaton, because from our research, these are some of the things that other parents with autistic children would try for their kids. So what we really had was the PEGS thing, but it's, like I said, it's challenging because he's not got understanding. So we're like looking out for other alternative treatment, because we know that there should be something that would kind of help this case. Because when you think about people with Alzheimer's or even dementia, or people that have got some form of learning disability or something, there are some medications or therapies that do help them. So my husband and I were thinking there may be something out there that would be able to help him in some way. So we were just, open-minded, researching, looking. I've seen loads of videos of parents talking about their kids with autism, and I'm always eager to know what are they doing, how did they manage it, especially those of them that would say their kid were non-verbal up until 8, 9, and then they said their first words. There was even this guy in Cambridge, he's a professor now, he didn't say his first word till he was 18. So stuff like that would give me hope that there is hope for him. So up until my brother-in-law, so my husband's brother, he came around last year during summer. So we were just having barbecue, and he said, he's got his friend whose son is autistic, because they know about our kid, whose son is autistic, and they came to this clinic. He didn't sleep at all at night, so he would stay awake 24 hours, even sometimes 48 hours straight, he's awake. And it was really challenging for them. The wife had to go from full-time to part-time, and then from part-time, he's just his full carer now. But they had about this clinic, and they've noticed some improvement in his sleep pattern, so he's able to sleep and all of that. So I was like, it was just a barbecue evening meal, evening get together as family. And I took a screenshot of he gave me your Instagram, Swiss Medica's Instagram account. And I took a screenshot of it and said, I would just mention it to my husband, because we were just, in the moment. But when we settled that, I would just mention it to him and say, and he was like, we should look into it, that the friend is really saying good things about the treatment, how it has helped their child. So from that moment on, I started going to your Instagram page to look down and see what is it all about, what is stem cell. Then I made some more research around stem cells. And I also, because being in, like, having some form of medical background and being a science person, I've heard of stem cells, but then now I had to look into how is it possible that it could be helpful to someone who's got autism. And then we looked at so many researchers, even like in India, in Panama, in Mexico, and in the US. You would see like testimonies of stem cell having been helpful or having been proven to help in this sort of cases, even with Alzheimer's, shoulder pain. Is somebody who had shoulder accident, had stem cell directed there, and that hand became stronger than the dominant hand than the hand that was the previously dominant hand. So many testimonies around stem cells. And then we started seeing, is stem cell good for autism? Does it help for autism and all of that? And there are so many researches around that saying that there could be potential in having stem cells, especially at a younger age. So we made contact. So my husband made contact with the team here in Swiss Medica, and he did the consultation. He was the one who did the video consultation because Swiss Medica here is in Serbia. So he did the consultation, and then he did all the paperwork and all the question answering and email back and forth correspondences, and the team were really nice and lovely. They were always ready and open to answer the questions that we had around this thing, because it's something new. It's not something we are used to, and we wanted to know even mode of how would he be getting this treatment? How is this procedure done? Is it invasive? Because some of the research we've seen, there's a spinal one, and we had concerns about that, because if anything goes wrong, he could, get paralyzed or stuff like that, because they will be going to his spine. So we got to know that this is an IV. They do the IV procedure and then the IM. So since that, like I said, since summer of last year, we've been in touch, having back and forth emails around even like the pricing and all of that, accommodation, logistics really around everything, concierge and all of that. And here we are. We've arrived finally in the end, and I would say it's been really nice, because when you, as a parent, you really want to explore whatever you can to help your child. So having this team that are very attentive to your questions and your concerns, and trying to reassure you, like there's this reassurance that we had from the team, everyone. So each person you spoke to is there to reassure you and give and renew like hope, and tell you it's worth trying. It's not like it's a miracle treatment, one of, I hope it is, but but like there's this reassurance that is really there to help you making this decision. Because if it does work for him, it will go a long way into improving his quality of life. Because now we are just like at his beck and call. We are having to do everything for him. If he's able to get some autonomy and independence, and like being potty trained, feeding himself, stuff like that. So he's got a high sensory need that he doesn't chew on food, but he will eat every non-food item. So clothes, glass, shoes, every non-food item, he eats it, but he doesn't eat on food. So once there are lumps in the food, that's not for him. So he would get a gag reflex. So he was placed on level 5, minutes and moist, by the speech and language team. But funny enough, he eats popcorn. So that's the only thing he eats. So we know it's not physiological, it's sensory. So if he could get some form of autonomy from having this treatment, being able to even brush his teeth, because any form of grooming is a challenge. Cutting his nails, having a haircut is a challenge. If he's able to, if there is an improvement in all of these things, him being able to, look after himself and have understanding of an awareness of surrounding, like he doesn't have any awareness of his surroundings. So which is like a hazard, it's a danger, because if you're out and about, he doesn't know that a car is coming or stuff like that. So you have to always be with him and guide him and all of that. So we are really like hopeful that this would be of help to him, given the track record of the experiences we've seen and the research we've done of all the parents and the experience with having this treatment for their kids. So we are just like, we have to give it a try. and see what it's like, how it would help and benefit Josie. And there's been a lot of research and peer-reviewed research about stem cell therapy in treating ailments and in treating disorders, and also autism. And even though it's not 100%, but at least there is 70%. It is there in the study that it's got 70% chance of improving the quality of life of someone who's got autism, especially when they've had it that young, at a young age. So we are really hopeful. It's about 50%, so there's a chance that it would work. So we are really hopeful that it does work for my son, really.
Have you mentioned to your pediatrician about performing, that you're planning to perform this?
No, we told his nursery that we are coming to have the stem cells, because the next time we'd be seeing his pediatrician is in 6 months, so it's 6 monthly to book an appointment. Though we did ring, but we left a voice note. So we've not told her face to face that he's coming for this.
So you don't know about her reaction, right?
No, we don't really know.
All right, later on.
She's in England, so they don't really do it in England, and we don't really know what her opinions would be around it. But we sought other people in the medical field to say, what do you think about this stem cell therapy? And some of them are indifferent. They're not really sure how possible it is that it would help in autism, and some others are like, yeah, they've had stories, they've read, they've seen researches where it was helpful in treating other disorders, but not really for autism. So outside of England is where we have more like doctors and scientists talking about how efficient and the efficacy of this treatment in helping kids on the spectrum. Especially in India, you have, an awareness around autism treatment, around stem cell treatment for autism.
So have you considered any other clinics before coming here?
So we also had correspondences with, there's a clinic in Panama, but it's a long way away for us from England, and they weren't really forthcoming with the questions and answers like Swiss Medica was. So we just warmed up to Swiss Medica, really.
I see. And how was your experience here in Serbia in particular?
Oh, so this is our first time in Serbia. It's been really lovely. The town is really beautiful. There's so many sites and all of that. We didn't really have any expectation whatsoever of, what to expect of the country, and then here we are. It's really nice, and the welcome from the airport, from the team to the hotel, and then here. It's been lovely. It's been amazing. Even my husband was like, we give them 5-star. They're really nice. Everyone is just has to beck and call. Everyone is doing their job. The cleaners, the kitchen. The food is amazing. We didn't really know that the food would be this good. Like everything on the menu, it's beautiful. It's delicious. It's lovely. So our experience so far has been nice. It's just like home away from home. So we are just like settled. It's just that we are not in our proper home, but we are like settled and okay, being taken care of as we go through this journey, which is really, really lovely, really nice to see. Yeah.
All right. There's a very last point I want you to mention is what kind of advice would you give to parents having autistic kids, experiencing all these challenges in everyday life? Should they go for it?
Oh, having a child on the spectrum is really challenging. It's challenging for both the child and you as the parent. And with every challenge, you keep wondering, how did it happen? Sometimes you'd be thinking, did I do anything wrong during his pregnancy and all of that? And when you check it all, it's not your making. It's something that just happens. Though the scientists are not able to say why it happens yet. And then with all the challenging, some people have had to stop their own careers and all of that. So because it's a really challenging situation for yourself and the child, it's best to give it a try, because it's best to explore, do your research, and see if it's something you would want to do. But I'm really open to trying it because I've done my research. We've done a lot of, looked into it, and we hope, we believe that it will be able to help our son. So as a parent, or parents with someone who is on the spectrum, is really, I would say just give it a try after you've done your research and all of that. With the testimonies and, like stories we've had and things we've read and the experiences of parents with autistic people who've undergone the treatment, is quite promising. So it's something you have to give it a try. I would say give it a try to improve the quality of life for your child and for yourself. Because with the challenges, you find out that you're struggling as well as a parent. The sibling is struggling as well, because we've got a little one and she's not able to understand why Jose can't play with her most of the time, or why he goes like that, or all of the screaming, all of that, all of the behavioral challenges that comes with it. So it will just help the quality of life of the whole family if it does help and if it does work for him. So it's worth giving it a try. It's worth trying, because there's really no other answers out there. You would just be given maybe pills for sleep or something, and at the end of the day it doesn't work. Will the child take these pills every day and stuff like that? But if this is able to it's like regenerative medicine. If it's able to rewire the brain, so to speak, and help them, live better life, it's worth giving it a go out.
Thank you so much.